My name is Paul Schomer, and I'm a member of the U.S. biathlon team. When I was 15 years old, I was a patient at Rogers, where I spent 3 months as a resident at the Eating Disorder Center. When I was in 8th grade, there was a weightlifting board at my middle school, and I knew I could get on that board if I just dropped a few pounds. So that's what I did. I went for it. And as a 13-year-old kid, I only used the knowledge that I had and did the best that I could, which at best was pretty bad. I got my name on the weightlifting board, but I also turned into having a full-fledged eating disorder by the end of that summer. I mean, I was always cold, I was depressed, I wasn't enjoying things that I used to, I was kind of isolating myself from other people, I was irritable. It was all those classic tell signs of someone who's not enjoying life and because they are just consumed with thoughts of food and exercise. And finally in the fall, I told my mom, I want to go see the doctor. I don't feel normal, I'm not happy anymore. And so we went to the doctor, and that's when I really started to realize what was all happening. And I stepped on the scale and saw what my weight was. I just broke down crying because I realized then at that point that I had dropped a lot of weight and that I wasn't at a healthy place. But it was even at that realization that I really didn't know what to do. When I first got to Rogers, I didn't know what to expect. I was put at inpatient at the beginning to have a little bit closer monitoring. About 3 days later, I went to the Eating Disorder Center, and I started to realize at that point, like, the only way I was going to get out of here was to do the program. And as sad as that may sound, that's what I did. I started to just kind of buy into the program as best I could. I definitely felt like I was there at a time where there's people that cared about you, and they also were going to be honest with you because they really wanted to see you get better. Coming into Rogers, you question if you're ever going to have a normal life again. You just become so consumed in your eating disorder that you question, am I able to go back to the way things were? It's just becomes so far in the past, and you get so consumed in the present that you forget that there is a possibility and that there is hope to one day live a healthy, normal life again. After I left Rogers as a patient, I didn't really think I'd ever be able to compete as an athlete again. And so when cross-country skiing presented itself, I was able to go out and just enjoy it for what it was. It was very therapeutic. And yeah, it eventually turned from a hobby into a passion. And people quickly noticed how I was pretty talented at it and that I may have some success in the sport. And so when I was a senior in high school, I continued to race more competitively around the Midwest and eventually wanted to go to college and ski at the NCAA level. And after graduating, began a full-time career in biathlon. And hopefully this year, we'll be able to represent our country at the Winter Olympic Games. People at Rogers, they aren't just concerned about getting you out the door and you're not just another number to kind of like put on their boards, but that they really are after you living a life to the fullest.